Why the ability to suffer became morally central. When people say causing pain is wrong, they are already making a moral claim. They are not appealing to law. They are not appealing to religion. They are appealing to something much more basic. Suffering matters. And that simple intuition is the foundation of what bioethicists call sentience-based theory, sometimes referred to as minimal sentience theory. Its core claim is straightforward. A being has moral status if it can feel pain or pleasure. Nothing more is required. No rationality, no language, no self-awareness, no autonomy. If a being can suffer, that suffering counts morally. At the center of this theory is one idea. Subjective experience matters. Specifically, the experience of pain, distress, or pleasure. Not biological membership, not future potential, not social relationships, but the simple fact that there is something it is like to be that being. If harm can be felt from the inside, then harm is morally relevant. This is why sentience-based ethics feels immediately intuitive to many people. You do not need advanced philosophy to understand it. If you see an animal cry out in pain, or a child recoil in fear, or a patient suffer unnecessarily, you instinctively recognize a moral problem. The wrongness is not abstract, it is visceral. One of the major strengths of sentience-based theory is that it explains why pain is wrong. Pain is not wrong because it violates autonomy, not because it undermines dignity, not because it disrupts social order. Pain is wrong because it hurts, because it is experienced as bad by the being who feels it. This gives the theory a powerful moral clarity. It also makes the theory inclusive in ways that capacity-based theories are not. Infants count morally, not because they are rational, but because they can suffer. People with severe cognitive disabilities count morally, not because they can reason, but because they can feel distress. Many non-human animals count morally, not because they are human, but because they experience pain and pleasure. In this framework, suffering does not care about species boundaries, and neither should ethics. This is why sentience-based theory plays such a central role in animal ethics. Most arguments for animal welfare do not claim that animals are persons. They claim something simpler. Animals can suffer, and unnecessary suffering is wrong, no matter who experiences it. This has reshaped how we think about factory farming, animal testing, and veterinary care. The theory is also highly operational. Unlike abstract ideas like dignity or personhood, sentience can be approximately assessed. Does this being have a nervous system? Does it respond to noxious stimuli? Does it exhibit pain behaviors? Because of this, sentience-based reasoning is widely used by research ethics committees, especially in laboratory and clinical settings. If an organism can feel pain, protocols must minimize it. If it cannot, fewer restrictions apply. This practical applicability is one of the theory's greatest strengths. Sentience-based theory also aligns naturally with utilitarian ethics. Utilitarianism evaluates actions by their consequences, especially the balance of pleasure over pain. In that framework, suffering becomes the primary moral currency. Whoever can suffer must be counted in the moral calculation, human or animal, young or old, able-bodied or disabled. Pain weighs the same wherever it appears. But this strength is also where the theory begins to fracture, because once moral status is grounded entirely in sentience, all suffering becomes morally comparable, and that raises difficult questions. Is the pain of a mouse morally equivalent to the pain of a human? If two beings can suffer, but one has a richer emotional life, does that matter? If one being can anticipate suffering and another cannot, should that count? Sentience-based theory offers no clear hierarchy of moral value. It tells us that suffering matters, but not how much it should matter relative to other forms of suffering. This leads to one of the most serious critiques. The theory risks flattening moral distinctions. If pain is the only morally relevant feature, then deeper meanings, relationships, identity, future aspirations, dignity, narrative, life, all fade into the background. Ethics becomes, at its core, a calculus of discomfort. For many critics, this feels morally thin. Human life seems to matter in ways that go beyond momentary sensation. Another critique is that sentience based theory can quietly reduce ethics to pain avoidance. But some morally important actions involve pain. Surgery, childbirth, rehabilitation, difficult truth telling, even moral growth itself. If pain is always morally decisive, how do we justify necessary suffering? The theory struggles to distinguish between pain that is tragic, pain that is meaningful, and pain that is unjust. There is also a practical problem. Sentience is hard to measure objectively. We infer it, we approximate it, we debate it. Does a fetus feel pain at 12 weeks, at 20, at birth? Do fish experience pain or mere reflex? What about insects, artificial intelligence, brain-injured patients? The theory depends on scientific interpretation, and science does not always give clear answers. When uncertainty enters, moral confidence erodes. And yet, despite these critiques, sentience-based theory remains enormously influential because it captures something ethics cannot ignore. Suffering demands moral attention. Any ethical framework that dismisses pain entirely feels cruel. Any bioethics that ignores suffering feels incomplete. For this reason, sentience-based theory often functions as a baseline, even in frameworks that reject it as sufficient. Even dignity-based or rights-based ethics still ask, who will suffer if we do this? So the legacy of sentience-based theory is not that it solves bioethics. It is that it anchors bioethics. It reminds us that ethics is not only about principles, categories, or abstractions, but about lived experience, about what it feels like to be harmed, and about the moral weight of suffering wherever it occurs. In the next lectures, we'll see how other theories attempt to go beyond sentience, introducing hierarchy, dignity, personhood, or relational meaning. But sentience-based ethics leaves us with a question none of those theories can escape. If a being can suffer, what do we owe it, and how much? That question continues to shape bioethics at every level.